Hi, my name is Dr. Shawn Blick, and I am a community urologist who's been in Phoenix, Arizona since 1999. I have focused my practice very strongly on the area of men's sexual health, and it's something called prosthetic urology, where we have surgical solutions for erectile dysfunction, for example, and/or urinary incontinence for that matter. I did start my own group approximately 25 years ago called Valley Urologic Associates, and was in that for many years until I joined a group called Arizona Center for Cancer Care. I was with them for about 15 years, and now I'm very excited to be part of Arizona Urology Specialists. We recently joined them in January of 2026, so I'm proud to be part of this 30-man urology group, a leading force of urology in the Phoenix market, and I'm proud to be a leader in this men's health, men's sexual medicine space where I can provide these services for this group. So thank you. It is simply first of all, it's the single best long-term treatment we have for erectile dysfunction because it has the highest satisfaction rates. All the conservative options that we offer in the field of sexual medicine, such as pills, injections, vacuum devices, shockwave, etc., they're all not spontaneous, they're not 100% reliable, and they have ongoing side effects and costs, and an inflatable penile implant solves this in a most special way. That's why it's the single best long-term treatment that we have for ED. It's just simply put, a penile implant is nothing short of an internal pump. That's all it is. It consists of a pump in the scrotum, a reservoir behind your pubic bone, and cylinders that go through the shaft of the penis. And keep in mind, this is all inside, all invisible, and all connected. So imagine this. Imagine that you could pump your scrotum and fluid moves from a reservoir into cylinders and creates a very natural looking, solid erection that lasts for as long as you want, whenever you want. Even if you ejaculate, you keep that erection. So in some kind of awkward way, you're sexually enhanced when you have a penile implant, and maybe some might say you're sexually invincible when you have a penile implant. So for those of you who don't know what a penile implant is, simply put, it is an internal pump that restores your ability to have an erection for as long as you want, whenever you want. Thank you. So you may be, if you're thinking about a penile implant, you might be saying, well, am I a candidate for that implant? First of all, most people actually are candidates. As long as you're able to tolerate general anesthesia for about 40 to 45 minutes, which is what our surgery takes, you're a candidate. So you just have to have cardiac clearance, medical clearance, and be able to tolerate a medical procedure. The whole procedure is 30 to 45 minutes, done through a 1-inch opening to do the whole procedure. So it's kind of minimally invasive. So most patients are qualified. It's important, if you're a diabetic, that your blood sugars are controlled. It's important that if you've had cardiac issues, that your heart can tolerate a procedure. It's important that if you have any predispositions towards infections, that those infections are well treated. But otherwise, just about most men are able to be qualified for a penile implant. So with regards to penile implants, it's unfortunate that over the years there's been a lot of misconceptions and misinformation in this space. And part of my goals as a provider have been to raise awareness and educate and demystify some of the things that are going on with penile implants. The most common thing that people talk about is that they think it's not safe. Somehow a primary care provider had a negative outcome for a patient, and then they translate into that all penile implants are bad. I would try to demystify that. Penile implants are a minimally invasive outpatient procedure that takes 30 to 45 minutes through a 1-inch opening with a modest recovery and an absolutely life-changing, transformational procedure for the men who get them. It is a safe procedure, complications are very low, and overall satisfaction is very, very high. mainly because it's spontaneous, it's reliable, and there really are no ongoing side effects and costs when it's finished. Most patients do receive insurance coverage. Medicare covers, many commercial plans cover. So bottom line, it's a very highly safe, effective procedure that is absolutely life-changing and transformational for the men who get them. Thank you. So when we do a penile implant, we do the whole procedure through a 1-inch opening where your pubic hair is located. You can also do it through the scrotum, but we mostly do it through the pubic area. It takes about 30 to 45 minutes to do, and all the components are put into position. This is ambulatory surgery, so you go home the same day, and when we're done, we do leave you inflated, so therefore there is a catheter to pee, a small drain that's going to pick up some extra fluid so you don't get swollen, and we wrap you up tight. The next morning, in under 24 hours, we see you back in our office, we take all that off, and honestly, it looks like we didn't even do the surgery. There's very minimal black and bluing or swelling. Over the next few days, there may be some, but by the end of a week, most of your recovery is over. You're sensitive, but you're recovered, and by the end of 3 weeks, and only 3 weeks, we're teaching you how to inflate and deflate and use the device, and we're many times finished. After we get everything off you on day one, you can do all the normal activities of daily living. You're not bedbound by any means. You can drive, you can walk, you can do light work. I just request that you don't do any heavy lifting for 3 weeks. So it's no hiking, no biking, no pickleballing or golfing for 3 weeks. So keep it light. So as you can see, it's a pretty modest, it's a modest surgery, minimally invasive, and pretty modest recovery. Thank you. So in my mind, again, the penile implant is the single best long-term treatment we have for ED because it has the highest satisfaction rates. When people have a penile implant, we often focus on the sexual side of things. It's natural to look at the sexual side of things because we're restoring sexual function. However, there is a side of this that is often missed. I would tell you that penile implants also have a profound impact on the male psychology. Men with ED, unfortunately, develop low self-esteem sometimes. They can develop low self-confidence. They may feel less whole as a man. When we do a penile implant, independent of the entire sexual side of things, a man feels more whole. They feel suddenly more self-confident and more self-esteem just because they know they can. So they're so much more likely to engage in intimacy, and their quality of life improves dramatically. So it's not only a wonderful restoration of sexual function, but is a profound transformation in the male psychology and the way a male feels. Very much akin to like a woman who loses a breast, God forbid. You know, they may feel less whole as a woman and they get a breast implant, and a male feels just the same. He just feels belittled as a male, and the penile implant restores all that. So it is a profound, life-changing, transformational procedure for the men who get them. Thank you. So I think as I finish up my conversation, I wanted to just say that if you are a male who thinks they may be a candidate for a penile implant because maybe pills or injections are failing, I just want you to think that it's important to find a urologist that does a lot of this work, someone who classifies themselves as a prosthetic urologist, someone who dedicates their work in this space. So that's someone like myself. I am a prosthetic urologist. I have a subspecialty in penile implants and artificial sphincters for that matter. And so I do a lot of this kind of work, and that means I'm likely to have a really good long-term outcome. I do sometimes 20 to 30 of these every month. I teach this locally and internationally, so I have a very broad range of reputation. It's kind of important to find someone who has a subspecialty, who cares about the work, who's got a real attention to detail, so that you're going to have an excellent outcome. Importantly, this is covered by insurance. Medicare will cover this. Many commercial insurance payers in the market will cover this. So it, in many cases, doesn't even require any out-of-pocket costs. So in conclusion, if you're potentially a candidate, seek out a prosthetic urologist, someone who specializes in this area, and know that in most cases this is covered by insurance. And by the way, we also do cash pay pricing and can work things out in that manner as well. Thank you very much.